Hello, I hope everyone is having a great Thursday. Welcome to everyone that is watching today's live stream, wherever you're watching from, whether it's Facebook, Instagram, or even YouTube. So thank you for watching. Today, I'll be talking about tips to boost your resume so that you can stand out in a sea of job applicants or sea of job applications and land an interview for an academic job. But before I do that, I want to first introduce myself. I'm Dr. Tim Miller, physical therapist and mentor and coach to faculty members and clinicians who want to transition into teaching. I myself was a full-time clinician who transitioned into academics. And kind of my journey along that was, first as a clinical instructor, and at the same time, getting involved in doing some lab assistant positions or, lab assisting. Then uh, found a clinical faculty job where my primary role was working in the clinic, that was run by a physical therapy school at the University of South Florida, and then helping out in the classroom, mainly in a lab assistant role, and sometimes, helping out a little bit more than that. And there, I really, found myself that I loved academics and wanted to continue, that career path, and was got a job at Nova Southeast University as full-time faculty member there in their entry-level blended DPT program, where I taught for 7 years. And while I was there, ended up wanting to learn a lot more about education and just found a passion for distance education. So I earned my EDD in educational technology from the University of Florida, while I was faculty member at Nova Southeast University. I now am the director of strategic distance education at Rehab Essentials, where I work doing curricular and faculty development for post-professional OTD, transitional DPT, and entry-level DPT programs. So anyway, that's a little bit of my journey, my experience, and also expertise that I love sharing. And that's why I kind of developed this passion for mentoring those who, again, full-time clinicians and looking into going into the world of academics, which is a wonderful world that I personally enjoy a lot. Um, what I'd like what I'd like you to do, if you're watching live, please type live in the comments and tell me who you are, where you're from, so that in the chat, I can know where you're watching from, or if you're watching the replay, please type replay, then tell me who you are and where you're from. Um, Also, I'd like you to type in the comments what is it about teaching that's pulling you towards a career in academics. And for me, it was having a passion for making a difficult curriculum, which is PTs are known, physical therapy, graduate programs are known to be, or any PT program, I guess, in that sense, making this difficult curriculum, exciting and fun to learn, and a good learner-centered experience for our future healthcare professionals. Too often students are really burnt out before they even have a license, and I just feel it really doesn't need to be that way in order to develop excellent entry-level graduates. Um, so as I said earlier, I'll be sharing some tips on how to boost your resume so that you can stand out in that sea of job applications and land an interview for an academic job. So chances are you are listening today because when you look at your resume, all you see are clinical skills or clinical experiences. And will be especially true if you are applying for your first academic job. And it likely feels, a bit of a letdown because you think, well, how can I even get an interview if I've never taught before? And especially when you constantly hear, we need more experience or more teaching experience. So, but believe it or not, you already have a lot of experience teaching others. So today I'll be sharing how you can highlight your teaching experience that you may not realize that you already have. So what I'm going over is not all inclusive, but my goal is to share examples of things that you're likely already doing that can be highlighted as teaching experience in your resume and job application. So first off, as a PT or OT, what you do on a daily basis as a healthcare professional is teaching parents, or I'm sorry, it's teaching patients and family members who might be parents, but teaching patients and family members about, about whatever it may be. I mean, this is what we do This is what we do as physical therapists or occupational therapists. We're constantly educating, whether it's a certain movement, safety, etc. So, how do you teach how you teach on a daily basis is part of your job in teaching. What is it that you like about that? And relate that to working with students or potentially working with students, or why a teaching career is a good fit for you. If it's like, in physical therapy, when I think about it, I teach all day, every day, and that's what I really get most excited about with my, working with patients. And I really have a passion, to be able to help teach students and really just tying that together because there's so much of, what you do as a healthcare professional that's, teaching directly to, the patients that you're working with. Similarly, teaching staff that you work with. So teaching CNAs, maybe techs, support staff, nurses, even physicians about, patient care, precautions, how to help you with, maybe it be a transfer, positioning, whatever it may be, that, phone call to whomever it might be of, hey, I saw this, and just that interaction within the healthcare team likely requires a lot of teaching that you do to others who may not understand, the, you know, whatever it may be related to rehabilitation, therapy, patient presentation. So really, you likely teach other professionals and coworkers on a daily basis. So this is something that you can definitely highlight, in your resume in terms of, well, I teach in this interprofessional team, and here's how. So you don't have you know, your job as a clinician, but you have examples of how you teach on a daily basis. Another really good example, which hopefully I think some may not highlight it enough, is being a clinical instructor. So taking in students and teaching in the clinic, these real life scenarios with real patients, preparing them to be excellent therapists. Highlighting this work as a CI is a really important way to boost your teaching credentials in your resume of, I've had this many students, from, who are on these, if they were first year students or, it was their final clinical before graduating or whatever, or anything in between, just really highlighting that because clinical instruction is such an important part of the academic side of, a PT or an OT curriculum. And, basically there wouldn't be graduates if there weren't clinical instructors. So if you are a clinical instructor, really highlighting that and, talking about those experiences and sharing, why it is that you do that and, what you enjoy about it and those types of things. Um, on the other side of student, or in addition to that, taking student volunteers who are getting shadowing hours for their PT school applications or whatever it may be, or maybe even be high school students who are, doing some type of, they're doing some type of, they have to get volunteer hours or whatever that may be. So interacting with those students, whether they, even if they're not physical therapy students, there is probably some teaching going on about talking about, what it is that you do or how things work or the profession or that may be, so even highlighting that. I mean, I know sometimes it seems like, oh, we have a volunteer here today who are shadowing, but those are things that you can really draw out and highlight in your resume regarding teaching experience. Um, Another one is just providing in-services. I know in one of my clinical positions early on, anytime a clinician went to some continuing education, whether it was a conference or that type of thing, it was expected that you're going to provide an in-service to the staff on what it is you learn, in sharing, basically sharing the knowledge that you gain from that continuing ed or professional development experience. So do you providing in services at work? And if you don't, perhaps there's ways that you could present different areas of your expertise, something you learn, something you may want to start to institute within your within your working environment, whether it's hey, we really need to have a better way to track X, Y, and Z based on the latest literature, or, whatever it may be. So that type of thing can count towards can really count towards your teaching. So providing in services to to your colleagues is really important to highlight, and exactly what those were, and don't again, don't sell yourself short on that being a teaching experience. Along the same lines, like journal club participation, if you have a journal club in your in your working environment, or if there's like a local journal club or a journal club through your local chapter of the APTA, or whatever it may be. Do you participate in a journal club? And if so, that can be used as teaching experience of, if there's a journal club and you have to present, on the journal article that you talked about, or there's just a discussion involved, that is another important area that I think um, is common, that people may not really, realize that, hey, this is a teaching experience, and this is something that can be highlighted on your resume. Uh, Also, community outreach. So, I had opportunities, as a clinician where, it might be like a lunch and learn that the local hospital was hosting, and they wanted somebody to talk about, management of back pain or headaches, or just something for the community. So a local lunch group, presenting on, something. So if you have any experience doing that, or and I'll talk about this later, or these might be experiences you can kind of seek out to get some teaching experience, because really giving those presentations, is teaching. So these are all areas that, I think show engagement within the profession, but then also, in the community, and can highlight, hey, I have experience, teaching in this capacity. Um, Another great way is, just providing, similarly providing presentations at local, state, or national conferences. It could be a poster presentation, platforms, or platform presentation, education session. These are great resume builders. Presenting at, whatever, if it's a local meeting or a conference, where you're teaching the attendees about a topic that you're passionate about, and you may have growing expertise in, or you have expertise in. And in my experience, a lot of the local districts for, like, state APTA chapters solicit for presenters for their business meeting. So it's that's one place that you can look in terms of, hey, we have this business meeting coming up, 2 months from now. We're looking for someone to present on a certain topic. Typically, it's a very, in my experience, it's been a easy experience, compared to, like, I think, or much easier than like submitting to a national conference to present an education session. That can be a little bit more challenging, but uh, you know the you- basically these local ones are an easy way to get that. But there are also, state conferences typically. So I think the state the state APTA conferences typically, are looking for presenters oftentimes, and then the national conferences as well. So this is just a great way to get presentation and teaching experience that looks great on the resume, because it's showing that engagement, it's showing that you have areas of expertise, and it's showing that you have you have experience teaching at various venues, and levels and sizes of audiences, and those types of things. And then the last three I'm going to share are more of those traditional type teaching roles. So lab assistant, roles. If you've been a lab assistant, or have if you've been a lab assistant, really highlighting that of being involved in teaching entry level students, guest lecturing within that, or even teaching teaching assistant as well. So sometimes it's guest lecturer, teaching assistant, lab assistant. So highlighting those experiences if you have them. So again, any of those that I just talked about, should be included in your resume, or help. Or if you don't have some of those, hopefully, it helps you think through of opportunities where you can do any of those to help bolster your resume. It's likely you may not have all of those, and if you only have a few, the list that I kind of went over, those examples I provided, should give you a roadmap of easy ways to gain experience. That if you feel that, oh man, I only have my clinical experience, and I've taken students, well, what are other ways that you may be able to start building that teaching resume, or building up teaching experience that you can highlight in your resume? So hopefully that list gave you just some ideas of experience that you have that you can really lean into and highlight. So the last thing I want to share is, beyond the experience examples that we just went over, another way to bolster your resume is to have a section in your resume that you highlight your teaching style. This comes up because in many applications for academic positions, which you may or may not have seen, and this is for even part-time positions, it's pretty common to be asked about teaching style. So for those of you who don't have a lot of formal teaching experience or don't have an education background or training in education, that kind of ambiguous question can be a little bit confusing and overwhelming. But in my experience, places are looking to see if you have an understanding, even a basic understanding of learning sciences and theories, and how these shape your teaching or how they might potentially, shape your approach to teaching. So, um, you know, clearly, you don't have to have an education degree to understand, some of these. Education degree would help, but just have a basic understanding of some learning sciences and how that may influence your teaching. And sometimes, if you have that directly in your resume, that can help get ahead of those questions as well. So, for example, I'll just share a really quick example. Do you or would you use a constructivist approach to guide your teaching? So, looking that up in terms of learning theories, the constructivist approach, shares that learning or learners construct knowledge rather than just passively taking information in. And they learn best when there are engaged learning experiences. So um, often you can draw on good and not so good experiences from what you had as a student and strategies that teachers or faculty use that made an impact on your learning, good and bad. And or maybe I should say not so good, are important that you can share of, hey, I had a faculty member and they, this is how they got me excited about learning this concept, and this is something I'm going to draw on. And I, in looking up about learning theories, I saw that this really aligned with constructivist approach, or whatever that may be. So again, provide concrete examples of your teaching style and evidence to support that style, and and that can really go a long way of knowing that you're aware of these, the basics of learning science, learning theories, and those types of things. So I hope this brief overview of how to bolster your resume, provides some insight on how you actually do have some teaching experience, even though you may feel like you don't. And even if you've only been a clinician, you actually have a lot of experience that you can draw on, and highlight within your resume. So I hope it also gave you some ideas of fairly easy things. Well, maybe not easy, but maybe easy. I don't know. If, fairly low-hanging fruit or things to do, such as presentations or other things that can really help bolster that teaching experience that doesn't require, getting hired on as a lab assistant. So that's why I say easy in terms of it doesn't require a additional position that you don't currently have to gain the teaching experience, but you can be involved in other ways. So again, hopefully, that just kind of gave you a brief brief overview of how to bolster your resume and highlight the teaching experience that you have. For me, helping therapists transition from a clinician to an academician is what I do in that complete clinician mentoring program. I help clinicians figure out the best academic career path that's best for you here at Clinical Connections. And we help to make sure that you set the path so that it's free from burnout and you love what you do. So if the desire to teach has always been there for you and you're ready to take that leap, but you're not really quite sure where to start, or you're not really quite sure what path to take or where to look in academics, because it is a really big world with a lot of different avenues, or maybe you've already landed that faculty position, but you want some support on how to excel in that role, using best practices for teaching and learning, then I encourage you to please reach out. This is a area that I'm very passionate about. So you can DM me, or you can write teach in the comments below, and I'll be and I will reach out with the details of the faculty coaching program, and we'll be happy to answer any of your questions. So I hope that you learned something new today. Please go ahead and put in the comments any aha moments or something that really stood out for you or something that you learned. And I want to thank you for watching, whether you're on Instagram or the Facebook group or on YouTube. Again, if you have any questions about what I talked about today, please feel free to message me or leave your questions in the comments. Thank you.